Hannah. I'm doing musculoskeletal and integumentary.
I'm Morgan, and I'm doing neuro and HE&T.
I'm Casey. I'm doing cardiac and pulmonary.
I'm Brittany. I'm going to do the abdominal.
This is Claire. She's a 9-year-old girl with dehydration.
Hi, my name's Morgan, and I'm going to do a quick neurological assessment on you. So I would start by just checking their general mood. Is Claire agitated? Is she withdrawn? Does she look stressed? Is she interacting with her parents? Does she have family? Does she have support? Just checking her general overall well-being, her orientation. Does she know where she is? Her name, her date of birth, all of those things. And then I would assess her cranial nerves. So olfactory, optic, ocular, motor, trochlear, trigeminal, abducens, facial, auditory, glossopharyngeal, vagus, spinal accessory, and hold on. Yes, so now I'm going to test Claire's cranial nerves. I'm going to ask Claire to smell peppermint or coffee or something like that to test her olfactory nerve. I'm going to ask Claire since she's 10, I'm assuming she knows her letters, so we're going to use the Snellen chart to assess her second cranial nerve. Her third, her fourth, and her sixth. I'm going to ask Claire to track my finger. I'm looking for nystagmus, looking to see if she tracks my finger. For 5, I am going to ask Claire to clench her jaw and report light touch. 7, facial. I'm going to ask Claire to puff out her cheeks and smile and make sure that everything's even. 8, I am going to ask. So for cranial nerve 8, I'm going to whisper something on each side of Claire's head. I'm going to ask her to tell me what I whispered to her. For 9, I am going to test Claire's gag reflex. For 10, I am going to a swallow test, right? We're going to have to redo that. So for 10, we're going to do a swallow test. For 11, I'm going to have Claire shrug her shoulders. Hi, ladies. You're good. For 10, I'm going to have Claire shrug her shoulders against resistance. No, sorry, that was 11. And 12, I'm going to have Claire stick her tongue out and say, ah. The last thing I would do is test her deep tendon reflexes, especially in the knee. And then Hannah in musculoskeletal is going to do gait, strength, Romberg, all of those musculoskeletal things that are also included in.
Knock, knock. Hi, Claire. My name's Casey. I'll be one of the student nurses that's going to help take care of you today. I'm just going to go ahead and do a respiratory assessment on you. Okay, so for respiratory assessment, I'm going to look at her general appearance, see if she has any cyanotic color, if she's normal color, pinkish, skin tone. And then I'm going to look at the symmetry of the anterior and posterior chest wall to see if there's any deformities or anything. And then I'm going to ask if she's ever had any surgeries, past history of any respiratory issues, see if she's using oxygen, look and see if she's using accessory muscles to breathe. And then I'm going to look at the cap refill too. That was probably in cardiac, but I'll just go ahead and do it in pulmonary too. Alright, Claire, I'm going to go ahead and listen to your lungs. So on the anterior and posterior chest, you listen in 6 places. So just place your bell here, listen for a few seconds, ask her to take a deep breath in and deep breath out. Then again on this side, down a little further. And asking to take deep breaths every time. And then you would ask her to sit forward and then listen in 6 places on the back too. So take a deep breath, in and out. Deep breath, in and out. Deep breath, in and out. Again. Again. And then one more time. And she sounds great. Okay, her respiration sounded good. Now we're gonna go ahead and move on to cardiac. So for a 9-year-old patient, a normal pulse is 65 to 120. And then normal respirations are 12 to 20. And blood pressure varies. So when I do a cardiac assessment, I'm going again just to look at her overall appearance, see her color, use of accessory muscles or any increased effort to breathe. And then I'm gonna check her pulse here, right on her radial pulse, just to see the
Sorry. Sorry.
the rate and rhythm of the pulse. Then I'm gonna check cap refill. Cap refill should be under 3 seconds. And then again, checking her pedal pulses and tibial pulses just to make sure that she's got a good one here. And then checking cap refill. Okay, to continue the cardiac assessment, where I'm just gonna palpate her carotids, not at the same time. Just to note rate and rhythm. And also while we're at the neck, I can ask Claire to turn her neck, and I can look for JVD as well. And then I'm going to go ahead and listen to her heart, and the landmarks are aortic, pulmonic, secondary pulmonic, tricuspid, and mitral. And then I'll listen to the PMI too, which is in the left mid-clavicular line down to the 4th or 5th intercostal space. And just listen again at the landmarks.
Love dub.
Dub.
Heart Sounds brought to you by me.
Action.
No, not. I'm Brittany. I'm going to be doing your abdominal assessment. I keep wanting to call it abdomen. I'm going to do your abdominal assessment, so I'm just going to go ahead and check your belly out. Pull this down. I'm just going to lift this up, okay?
Provide for privacy.
Provide for privacy.
That's what we're doing.
I already closed that curtain. So first of all, I'm just gonna check it out. Check for symmetry. Check for color. I'm gonna check contour in 2 different places. And then I'm going to go ahead and listen to it first. So, and I'm listening for vowel sounds in all 4 quadrants, starting at the right lower one first. And then I'm going to turn it to the bell and listen. And I'm going to turn it to the bell part and listen for any abdominal, bruise that would indicate maybe an aneurysm. I'm also going to look for any palpable masses or any hernias or anything like that. And then I'm going to palpate it to see if there's any tenderness. So do all 4 quadrants again, starting with the right over. And that is it.
Ta-da!
Hand hygiene. Hi Claire, I'm Hannah. I'm going to be your nurse for just here a few minutes. I'm going to do an integument and a musculoskeletal. So I'm going to take a look at your skin. And so I'm going to start by looking at through your hair. I'm going to make sure that there's no lice, because there's a lot of lice outbreaks in kids this age. So I'm just looking at the distribution, the color. I'm also looking at her skin. She is a little flush from dehydration, I guess, but she's pink and moist, and she's warm. She's not cold. I'm also going to check for dehydration. So I'm going to lightly pinch over the clavicle just to see if there is any skin turgor, to check for any dehydration. I'm also going to look at her hands and her feet for any swelling. I'm going to do cap refill again, as Casey has done, and she still looks all good. I'm also, as I'm just inspecting over, I'm going to make sure that there's no bruises and no lesions, no abnormal wounds on her body.
Go.
Also on little Claire's hands, we're gonna look for any clubbing. And then we're gonna look at musculoskeletal. So just go ahead while she's in bed. I'm going to have her put her arms up, and she's going to try to push down on my hand and then up on my hand for resistance in both sides. I'm going to have her rotate and flex her wrists and her elbows. She's going to go in motions like this for coordination, as well as with her ankle. She's gonna and flexing the knee. And there's also no clubbing in her feet. Then Claire, I'm gonna have you stand up. I'm going to do a Bromberg's test where I'll have her stand with her hands down at her sides. I'm going to put my arms like this. So then we're going to do a Bromberg's test. I'm going to have her stand with her hands by her side. And I'm going to put my arms out like this so that I can check and see how much swaying she may or may not be doing. She's fine. She's just here for dehydration. Also, I'm going to have her walk for me so that I can see the curvatures of her spine to check for is it spina bifida?
Spina bifida.
Scoliosis.
Scoliosis.
And I'm also, so after I watch her walk, I'm going to have her kind of lean over like this. I'm going to palpate her vertebrae to make sure that they are in the correct lineage. Again, with the musculoskeletal, we are going to look at the hair distribution on the entire body. She's 9 years old. She may not have a whole lot of hair yet on her body, but we'll just check for it just in case. And again, we'll do pulses on her radius, pedal pulses, and general balance. While she was walking, that was another thing that I was looking at. And I think that about sums it up. I didn't say what was on.
Now you're gonna start with the head.
First, I'm going to start with the head. So, well, Hannah already checked for lice, so I'm not going to recheck her for lice. But I am going to look at the distribution of her hair. I'm going to look for any bruising. Casey covered the carotid. I'm going to check to see if her lymph nodes are enlarged, because that could indicate maybe an infection or something. Okay. I'm also going to check little Claire's face for symmetry. And Casey checked for JDD, but I'm just going to double check. Next, I'm going to do ears, nose, and throat. So I'll start with the ears. So I'm just looking for symmetry. I'm looking for drainage. I'm looking for any inflammation externally. I'm going to use an otoscope to look for any inflammation, anything wrong internally. Looking at to see if it's gray and pearly, right? Gray and pearly.
Mm-hmm.
Then I'm going to look at the nose. I'm going to make sure that both nares are painted. Going to use my pen light to look in the nares and make sure that there's no bleeding or trauma or anything. I'm going to make sure that her septum isn't deviated. There's no drainage, redness, same thing with the nose. And then same thing with the mouth, making sure there's no sores, making sure that she's not. So I'm going to look in Claire's mouth for any sores. If Claire has dentures, I'm going to make sure her dentures are fitted.
God, I don't know what happened.
Just kidding. I'm going to make sure that her. Over here, you.
Picture day.
Over here. Make sure that she's not excessively swallowing or anything. Make sure that there's no drainage. Yeah. I'm also going to check for midline tongue protrusion. Make sure that it doesn't go one way or the other. And last but not least, I am. Hi. Hello.
Oh, she's going to be in the video.
I'm going to look at her eyes. First thing I'm going to to check his accommodation with my finger. I'm going to have my finger out here, and I'm going to have my finger close. I'm watching to see if her pupils are reacting. I'm also going to check with my pen light. I'm going to make sure that her pupils are brisk. I'm going to make sure her pupils are even. Make sure there's no discharge. Check the distribution of hair on her eyebrows and her
Lashes.
Yes, her lashes. Her falsies.
Eyelash extensions.
And yeah. Let me think.
That's good.
Wait, I'm gonna make. You ready?
Mhm.
Good. Okay. I'm gonna make sure that her eyelids aren't drooping. I'm gonna check the conjunctiva, and I'm going to look at the color of her sclera. And I think that's it.
Ta-da!
And don't forget to check Claire's red reflex.
And that concludes this
checkup!
checkup.